Okay, it looks like we are all here. So I just want to welcome everybody. Hello and good morning. Everyone, my name is Jamie Adkins. I am the Director of Business Development at MedShift. And I want to thank you all for joining us this morning to learn about a technology that we recently brought to the MedShift portfolio. We think it's really going to help you all enhance your overall patient experience when you're delivering treatments. So today we are excited to be talking about Nitronox, which I personally would describe as a safer, more advanced form of some of the nitrous oxide delivery systems that I've seen available to our market today. So we're very excited to be partnered to bring you this technology. And we've invited two guests who are actually going to join us from Plymouth. They're going to be in our waiting room today. So if you type in questions during the presentation in our chat feature, they're going to be here to answer those questions. And I just want to call out Andrew Shepard, who is the co-founder of Plymouth Medical, and John Malone, who is a clinical trainer and has decades of experience with medical technology and in this aesthetic medical industry in general. So we're excited to have them on with us today. And we're also really delighted to have our guest speaker, Dr. Lana Chuck, with us here to take a deeper dive into the Nitronox systems, also to share how she's using the devices in her practice and some reasons why it's the perfect complement to just about every procedure that we offer here in aesthetic medicine today. So before we get started, I'd love to give our keynote speaker a brief introduction. Dr. Lana Chuck, who you see here, is the CEO and founder of, and also the medical director of LC Medical in New York. And she's a board certified urologic surgeon and a self-taught businesswoman who has built her brand into multiple million-dollar businesses. And one of those businesses is Face Med Spa Training. And she's the CEO and founder of that training group who offers private lessons for medical professionals to learn facial aesthetic injection techniques. So Dr. Chuck is regularly seeing injectors from all over the world who are looking to enhance their injection skills. And I'll also share that she's the co-founder and CEO of Face Med Store, which is an online shop that specializes in the distribution of medical equipment. And they launched the Aesthetic Skin Institute Learning Portal, or ASI, which is the first comprehensive virtual training for aesthetics. So being such a busy woman, I just want to thank you, Dr. Chuck. We are very fortunate to have you here with us today and appreciate you taking time out of your morning to educate us all. Before we begin, I just wanted to run through our agenda here. Of course, I just did a brief introduction on the beautiful Lana Chuck, but following this event, we're going to have a live Q&A session. So some of those questions that you ask during the presentation, which of course I encourage you to do, type those into the chat box. If we don't get to them during the event, we will get to them during our live Q&A. And then I'm going to talk briefly on how to stay in touch with us if you have some interest in Nitronox and perhaps getting, a Nitronox system into your practice. So with that said, let me get this presentation started and turn it over to Dr. Chuck.
So much, Jamie. You guys see me?
Your camera just turned off, Dr. Chuck. I would try it one more time. I'm going to.
Perfect. I see myself now. So thank you so much for the introduction, the warm welcome. I've been working with Plymouth Medical now for, I would say, probably about 6 years. And I've been working with specifically Nitronox for the last few years. A little bit more of a background on me. I'm in the heart of New York City. I'm flanked between Columbus Circle, the Plaza, and Central Park South, and I have a large practice. We have 8 injectors. We have 2 plastic surgeons and OBGYN that works with us. So we kind of like a beautiful culmination of multi different disciplines in our practice. As you guys know, I am a urologic surgeon, but about 7 years ago I pivoted into aesthetic medicine and have not only I'm a surgeon, so I'm always see one, do one, teach one. I actually taught anatomy, got a full scholarship in teaching anatomy, so we actually host facial anatomy boot camps and aesthetic boot camps, and I also became medical director of my own practice, and now we have 3 locations in the New York City area. So really excited to be here discussing something that is very important to me, which is Nitronox. So just to get started, Nitronox and Plymouth Medical has been around for about 12 years, and I've known Joanne and Andrew for probably 6 or 7 years. But it's female owned and operated. And I will say that if you guys have ever met Joanne, she is a trailblazer. She is one of the smartest people I know. When I met with her and I sat down with her to talk to her about, her M-Site PRP and then now our Nitronox, I was just blown away by everything that she knows. She's so knowledgeable about everything, but she really specializes in orthopedic sports medicine, so PM&R, pain management, and then also into the aesthetic field like dermatology, plastics, aesthetics, urology, and I'm a urologist and OBGYN providers. It's a dynamic company that really kind of builds relationships with their customer base. And so just so you guys know, we have a huge community that we've built on Facebook called the Aesthetic Medicine and Wellness Group. And we have one that's for nurses, PAs, and Ps, and then specifically one just for physicians. But it's great because we're able to really create an environment where we can help mentor, but ask all the questions that we need to ask, and are able to help give support and trainings to a lot of injectors out there. And so moving forward, a little bit about Nitrous. I know you guys are all here super excited about Nitronox. It's been in the US for about 4 years now, and I've had it probably for about 3, I want to say. As you guys know, Nitrous is very safe. It's been used for almost 50 years, and now we're seeing it in hospitals, used in L&D for labor and delivery, and we're seeing it used in dental practices all over and urology practices all over. Anything that is procedurally related, whether it's PM&R, whether it's ortho, sports medicine, and of course now dermatology, cosmetics, and aesthetics. So we know that moving forward that we have different gauges and levels of our Nitronox. So I'll talk about it briefly, but what I really want to do for you guys today who are on this live webinar is to really show you guys how I utilize it in my practice and how it's not only increased my ROI, which is really important for us entrepreneurs and business owners, but also as provider, injector, and physician to be able to deliver not only safe procedures, but very comfortable procedures so that you can get better results. And isn't that all we ever want? We are results driven. We want to get great befores and afters. So Nitronox is a simple way of delivering laughing gas, as we all know, to your patient. So it's an anxiolytic. It really helps to decrease that anxiety, kind of takes the edge off. Certainly our patients can come in, taking, medication orally by mouth, but, I've had patients that have done that before, and they've done Nitronox before, and they basically said that Nitronox was a much quicker, easier, faster acting procedure, and they actually love it, and they're so happy afterwards that sometimes they ask us if they can just come in for the Nitronox, which is really funny. But basically, I do a lot of procedures in my office, whether it's my full liquid facelift with lots of fillers and thread lifts, and also Morpheus. I am a KOL for InMode as well, and I speak on stages for InMode because, we are the trainers for InMode, and we get great before and after results. I would love for you guys to see some of our results on my Facebook page, which I'll go into a bit later, but really utilizing Nitronox, and you'll see it all over my social media, patients utilizing the Nitronox, saying this does not hurt at all, and then showing you the results, the before and afters. And so really giving patients more of a positive view of the procedures. And as you know, the biggest question that anybody ever asks, especially with Morpheus or any other laser procedures or any type of RF microneedling, is how much does it hurt, right? So if you're able to offer them something that not everybody has, it's going to put you on another level where people are going to say, well, not only do they, perhaps have really great topical numbing, we could talk about which ones I use, or we Temess with lidocaine anesthesia, but we also offer Nitronox. And because we offer this really puts up in another, echelon where people are willing to come in because they're afraid of the pain. And I will tell you, after we start their procedure, they're always saying how they feel like it's so much better than how they anticipated. And that allows us as physicians, injectors, providers to be able to get deeper and to get more passes, which means better outcomes, right? And so it's great to use online and social media. I do a lot of social media. I've been growing my social media practice and my brand for the last few years. If you guys have any questions about how to do that, definitely happy to give you some pearls as well. But really, just it's been such an important part of adding it to my practice that now I'm able to offer patients an anxiolytic, and I do lots of procedures, not only with RF microneedling, but all other energy-based procedures and a lot of sexual health procedures for men and women. Okay, so what does it replace? Certainly, we have the patients that come in and they're like, Doc, I took a Valium before I came in. I took a Klonopin. I had a patient yesterday who took a Klonopin before she came in. And she said, you know what? I actually didn't really need it. So number one, it's an anxiolytic. And so it does help replace all these. Now, certainly if, you have prescriptive abilities and you want to prescribe medication orally, that's perfectly fine as well. And there are patients who will ask for that. But really, I would say the amount of patients in our practice that really needed a prescribed oral anxiolytic is like 0%. So moving forward, but it doesn't replace any topical lido. So it's not as if patients coming for, if patients are coming for, injectables, they're not, they may not need this, but I do have a lot of patients with, that are coming for injectables that, want this. So my lip filler patients, my thread lift patients, my celebrity liquid patients, even my patients that get Sculptra for full face biostimulation, they're asking for Nitronox. It's just something that we offer in case they're very nervous. And you guys get this all the time in your practice, I'm sure. Like, I'm really nervous about this procedure. Will it hurt? And so this is a great way of saying, well, we have it. And this is something we certainly can add, onto your treatment plan. And that's another important thing, is really discussing with your patient the treatment plans and then answering all their concerns about anxiety, pain level, results, etc. So definitely we still do our BLT cream. I actually prefer lidocaine tetracaine. We also have a specific formulation that we do for our Morpheus or RF microneedling patients. But prilocaine, ice packs, all those things. We do have a vibrating device, but when you use the Nitronox, you don't need that as well. Okay, so is it safe? That's probably the second question that you guys have. Is nitrous safe? And absolutely, nitrous is safe. It's been used for over 250 years with pediatrics. We've seen it all in dental pediatrics, and so very, very safe to use. It's a very short half-life, so it really leaves your body from seconds to minutes, right? So those people who are driving in, I'm in the hub of New York City. We have patients driving in from all over. We have patients flying in from all over. We have patients taking subways, taking hours to get here. And so we absolutely want to make sure that they are safe to drive. And someone, is taking some Ativan or Klonopin, we don't want those patients driving home afterwards. And so this is a great alternative to anything orally. And so some of the things, safety feature wise with the Nitronox machine that you may not see on any of the other nitrous machines that you have, is it actually prevents the flow of nitrous without oxygen. It's self-administered, so patients are actually breathing it in themselves versus something that's continuously given. And so what we do is we tell patients to take 5 to 10 deep breaths with the nitrous, and then they take it out. So for instance, if you're doing a lip filler and they're really nervous about, the pain with lip filler, you can actually have them do that 10 breaths or 5 to 10 breaths, self-administered, and then they take it out, and then you can really start to work, on them. So they don't have to have the nitrous in their mouth the entire time, because some of you may be thinking, well, how am I going to get, my lip filler done when they're sucking on this nitrous? So it's really just something available to them in the beginning, and then they're able to take it out, and then they're able to go ahead and self-administer anytime they would like. And in our case, I have the Nitronox Plus, so we can get an additional 15% of nitrous in case they're not really breathing heavily. And there's 100% oxygen capability. I know that during pandemic, everyone was super nervous about oxygen tanks and getting oxygen. This is great because this has oxygen and it has nitrous for patients, and there's a key lock system. So you're not going to be, letting any nitrous slip, or you're not letting anyone else use it or anyone borrowing it, because it is a key lock system. So it's very safe, and it's used widely in our office. And I have multiple offices, and sometimes, multiple offices can use more than one Nitronox. And so what do we use it for specifically? So depending on what you guys do, it can be used for anything. So here in our office, we basically have every single machine. I think we have like 12 machines, most of it from InMode. So any of the Morpheus, any of the Empower for sexual health, for vaginal rejuvenation, we use. We also have Cool Sculpting. We use it with our dermal fillers. I have Face Tight, Body Tight. As I said earlier, we are a surgical practice as well. We do facelifts, necklace with our board certified facial plastic surgeon. So, and I've also had Awake Lipo with Nitrous, with our Nitronox. So very tolerable in our office. Obviously, just regular microneedling. Our patients sometimes feel some discomfort with microneedling despite the topical. So it's something you can offer them. We've actually had patients ask for nitrous while just getting the administration of toxins, so neuromodulators. PDO threads for sure. I mean, a lot of our patients, especially the first time, are a little nervous about PDO threads, and we make it very comfortable in the way that we do them, but certainly having the addition of Nitronox has made it much easier for our patients to undergo this procedure in a very relaxed way. And we all know when patients are relaxed and they're not moving, they're not agitating, they're not saying ow, it makes you feel more comfortable as the injector provider, proceduralist. And so you're able to do a better job and do what you need to do to get those beautiful lips, to get that face lifted, or other procedures that you guys are doing. As a urologist, we do a lot of P-shot, O-shots. I would say we probably get about 5 new inquiries of, a sexual health with PRP, and also for hair and face. And we do a lot of PRP facelifts, we call them, or facials, and also for hair. Now, hair, as you know, is super important for women, but very super important for men. Men care a lot about their hair and their penis. And so being able to offer something where you can do hair restoration with PRP or PEP factor, we do a lot of PEP factor microneedling. Those things are really important to be able to offer your patients, so you don't need to do a full scalp block. In fact, for my hair restoration patients, we never actually do a full scalp block. It's not necessarily when you're using the Nitronox. Any laser treatments or laser, tattoo removal treatments, even hormone pellet placements. As a urologist, we do a lot of male sexual health as well, and hormone optimization, etc. And so this is a good way of getting those patients who are a little bit nervous, but it's such a quick procedure. And or any other treatment where the patient is anxious or embarrassed or in pain. And just a quick story. We do have patients who have so much fun with the Nitronox, and they're so happy and they feel so good that they literally ask us if they can just come in for Nitronox, which obviously the answer is no. But with things like Morpheus, you're going to need 3 sessions. So they're going to know that you're going to want to book that with that patient for the 3 sessions. And there are some times where, we have, like I said, 8 injectors. So multiple people are running back and forth from room to room. And we have 9 rooms, including an operating room that we're certifying. But it's nice because, you can really wheel it around and, mobile. Okay, this person's numbing, so let's bring it to this room. So it's really very practical and can be used in multiple rooms in multiple locations as well. So again, how do patients react with Nitronox? We'll talk about this slide, and we'll talk about what's in some of the studies, and I'll talk to you a little bit about what I'm seeing in my practice. But very comfortable, very relaxed. So you'll see their shoulders, instead of up here, really start to relax. Their legs are uncrossed, and they have some nice deeper breathing, and they really start to calm. That anxiolytic is just working perfectly, and that's when you know that you're able to start your procedure on them. And I do a test dose, whether it's do you feel this? Are you anxious? Or, here's a couple of Morpheus passes. How are you feeling? The patient's very happy. They're aware of their surroundings. They are answering you back. They're talking to you. So sometimes eyes become like less, bright and active, but for the most part, we're telling them to breathe in, 10 deep breaths, and then taking it off and then bring it back on. So, and there are some that just really want to suck on it the entire time. You don't need to, you tell them they can take it off. And, so some of the things they can experience is a little bit of tingling, a little bit of heaviness, body warmth, and, a lot of it is just vasodilation in the face and neck. And I'm going to talk a little bit about vasodilation in the face and neck because there are times when we want vasodilation, right? There are times when we're working and injecting the penis that we want some vasodilation. And so that's helpful as well. And changes to voice. One quick thing that I'll say to everyone on this live and everyone who's going to listen afterwards is that, we've had a vascular occlusion in which we've used Nitronox on patients. And they're actually, my colleagues are actually starting to write more papers and do more research at the vasodilatory effects of using Nitronox when there is some sort of vascular compression, occlusion, decreased blood flow. So all these things will come into play. Okay, so next. So how do I monetize Nitronox? So you guys are all in the medical field. You guys want to make sure that your ROI is there. So one thing I will say is there's really two schools of thought. One school of thought is let's monetize and add a specific pricing to this so that patients know that they can get upcharged and they'll get this procedure. And then there's another school of thought to say, well, if my patients are comfortable, I'm going to get better results. So maybe I want to just absorb the cost, but make the packages a little bit higher. Whichever way you do, it's really up to your practice. But what I do in my practice is my patients, so we already have, higher packages, just so you guys know, my pricing for toxin neuromodulators across the board is $24 a unit. My under eye filler starts at $1,500 per one syringe. So I do charge a little bit of a premium. And then when I do my, my package of my celebrity liquid facelift, the minimal spend is $3,000 for 3 syringes, right? And then it adds on top of that. So here's the thing: when patients have the package and you package it nicely, they're happy to pay for it. They're happy to pay for feeling comfortable. They're happy to pay for getting the results. And so for that reason, you can definitely put it into a package. And so therefore, instead of maybe $3,000 for a package, it'll be $3,500 for a package or $3,800 for a package. So you can always package in that way. What I do is I actually charge extra for it. We charge $150 to $250 for any patient that gets the Nitronox. And the way that we tell our patients is really, we're able to get this procedure done for you. I know that you're very nervous the first time. We have the Nitronox, which helps decrease your anxiety and your discomfort and your pain, and you're more comfortable that way. And I will say that some patients who are very anxious, they're happy to pay the $150 to $250. Super happy to pay it. In fact, they're so happy to pay it that, like I said, they're willing just to come just to pay for it and not get any treatments. And so never underestimate, never undervalue what you do for the patients, right? And never decrease your pricing just to get patients through the door, or never decrease your pricing just to get the packages sold. When patients know your value and and you're making it comfortable and they know what great results they're going to get, they're happy to pay. So that's the one thing I'll say. The tube costs probably about $30 plus or minus per patient. So you do get an ROI on this. And not only do you get an ROI, but you're getting more patients into your practice that are going to come to you because you have Nitrous and Nitronox, and they're more comfortable with that. Okay, so how do I market it? This is my social media under Dr. Lana spelled out. And we have now almost 100,000 followers. As you can see, a lot of what I post, some procedural related, and patients, and also injectors, physicians, nurses, NPs, dentists, everyone who's doing these procedures want to see the procedure. They want to see how comfortable patients are, right? So if you're posting that you have a microneedling procedure or RF microneedling or a thread lift procedure, and they're seeing the discomfort on the patient's face, they're not going to want to do it, right? And so when you use Nitrous, and you'll see all throughout my pages, you guys can see how I market it on my social media to get my thousands and of views, and my comments is really just to showcase it and to say, hey, this is what I offer. And when they see that you offer, patients are very well educated. They know Nitronox by name, and they'll ask specifically, do you have Nitronox? And then when they see us use it, they actually help answer all the other people's questions of what is Nitronox, what are you using? And people, and all the other patients or clients are actually writing down, it's great, I use it, and it makes you very comfortable. And so I do talk about it on my website that we have it, because I really think it's going to help separate you from a lot of the other competition, that you have something extra that's going to cater to their pain. As practitioners, as proceduralists, as people who do a lot of aesthetic medicine and have, myself that have been doing this for many years and have patients flying in from all over and doing full face liquid facelifts and balancing, we definitely have to have a way of making them feel comfortable, because not only are they in there to look beautiful and to get the results, but one of the things that I love when my patients say to me is, Dr. Lana, I feel like you have such light hands and I didn't feel pain. And, if for those people who are a little bit heavier handed, this is great, because they're not going to really feel that, right? So when I inject, I'm very light-handed. I know exactly the pressure that I need and where I need to be. And I don't push too hard, and I go slow, especially in tear troughs, which is one of my specialties. And so really important that, your patients are comfortable, because they will remember the way that they feel when they're in your seat, and they will remember the results and how they feel when they look in the mirror. So that part of it, that emotional component of how they feel, how comfortable they are, is so important. So then when they think about coming back to your practice, when you say, let's pre-book you for the next appointment in 1 month, they're not going to have that negative kind of, that negative connotation of coming back to your office. They'll have a very positive way. So let's look at Nitronox versus Pronox. Certainly when I first started, there was Pronox, and I've used Pronox, but then as, things go on, the technology gets a little bit better. And so, yes, I do have, Francesca, the Nitronox Plus. And so we're able to get a higher level of nitrous. And for some patients, they want you to start all the way up high, but then you say, no, we're going to start low. Take the 10 breaths, because a lot of times they just feel like, I'm so anxious, I really want the higher. But when you deliver it slowly, they do much better with that. And so it's definitely I've seen the pros and cons of Nitronox and Pronox, and I would pick Nitronox over Pronox, which is why I purchased the Nitronox Plus in my practice. So it's really just, do you, what technology you want, right? Do you want something that is newer technology, delivers more nitrous, has more safety, et cetera? And now more people know about Nitronox, and they're actually asking me for the brand name Nitronox, right? And so these are some of the differences. And so nitrous can be adjusted with the Nitronox from 0 to 70%, or it could be fixed, right? So it's really your choice. Sometimes when my patients just keep sucking on it and they don't really need it, like I'm actually done with the procedure, but they keep wanting to suck on it, you may want to fix it, right? And also has an emergency fail-safe. So if for any reason, they're not breathing enough or et cetera, it increases the oxygen by 15%. So there's a fail-safe. It's better technology. It could deliver 100% O2, which, Pronox can't. So if you have that patient who, needs oxygen for whatever reason, whether they're vasovagaling or something, and they don't even use the nitrous, you can just use it for the oxygen, right? Or you can just use it if you, for God forbid, there's some sort of vascular compromise, you can just use the nitrous over oxygen, but you can also use oxygen as well. The gauges are, right there. It's very easy to use. We have, every single practitioner here using it, but also every single office member and staff use it, because they come in and they train us how to use it. It's lockable. There's a test button. There's 2 or 4 cylinder options available. So if you're, practice that does prolonged procedures like liposuction, face tight, body tight in your office, you can definitely opt for that. There's a 3-year warranty, which is amazing. It's made in the US. With Pronox, I know there was some FDA recall. You can't really adjust the dose. And there's a lot of variability. And that's what I noticed with my Pronox patients in the beginning when I use that. And you can't really flush out with oxygen after the treatment, and you can't lock the device. So for all those reasons, we are really a big Nitronox fan in our practice, and safety is key. And I need to have all these safety features with my procedures because we have lots of injectors here, and we need to make sure that, when our patients are, let's just say flying in from Napa Valley for the 2 hours they're there and flying back, we need to make sure that everything is safe, right? So in conclusion, I use Nitronox. It really suits my clientele, my patients. The gas is, like I said, out of your system within seconds to minutes. I would say seconds, but minutes, right? And so I would say probably about 5 minutes later, they can really just, feel completely back to normal. And so it's very bearable. It's faster for me. I know, like I said, I have about 5 Morpheus machines in my practice. And so, because we have multiple patients, multiple rooms, multiple practitioners using it, right? And so it's so much faster for us after, giving them Nitronox, because we just fly, and we're done with our procedure so quickly. And if you guys look on my page, you can see the results. And I'm happy to DM me on Instagram at Dr. Lana. I'm happy to show you our settings for Morpheus, and also our settings for, our Nitronox. There's really no, setting. You just click it to the 30%, you start there. But really, it's some of the results that we're getting with the Nitronox. And some of you guys probably hear like, hey, I hear that Morpheus or my RF microneedling has variability. Some people say it's great. Some people say it's not great. Well, I'm going to tell you, it's 100% dependent on the operator, right? People think that when they're purchasing Morpheus, that they're purchasing something that the machine does. Absolutely not. We educate our patients. It's not the machine that does the work. It's the operator that does the work. And if the operator can do the work and go a little bit deeper with more energy, with more passes, and get you comfortable to get through the procedure, and we know the exact settings to use when we want to target fat, when we want to target skin tightening, etc., it is all up to us for the results. And there are a lot of people out there who are not doing the procedure right, who are not numbing the patients right, who are not, don't have access to Nitronox. And that's why you have all these negative comments or these concerns with patients. But I'm telling you, once they come through and you do the first one for them, 100% they will buy the package, or they'll buy the package up front. Right. And so it really helps your patient. It's not expensive addition to your practice. Like I said, I've got 12 machines, and those things are expensive. Why not just invest the additional small investment to your practice? And so every time I talk to my patients about pricing, it's never about, it's going to cost you this much. It's an investment of this much, right? And so really, it's a very easy way for us to say, let's get you through this in the most, low anxiety way to give you the best results that you deserve. And so that is the end of my talk. I hope I was able to answer some of your questions. I know there's some questions on here that John is answering back, and I just want to say thank you so much to Plymouth Medical, to Joanne, to Andrew, for allowing me to come on this and really sharing my experience with Nitronox in my practice, in my 3 practices.
Well, Dr. Lana, thank you so much for your presentation today and for sharing that wealth of information about Nitronox. For everyone that's still with us, we are doing a live Q&A. I know we had a couple questions that came in both individually to me and also to the group. So Dr. Lana, you answered one of those questions during the presentation, but I think we've got a couple more. And before we jump in, if anybody has an interest in Nitronox after the presentation, of course, reach out, Dr. Lana. You can scan this QR code to learn more. But let's actually dive right into our Q&A. I got a couple questions. The first one I got was, how long does a tank of oxygen last? And I don't know if there's a question, Dr. Lana, maybe you can help us out on that.
Absolutely. So there's 2. One is nitrous and one is oxygen. And it really just depends on it depends on the variability of the patient and how much they're using. So I would say for us, it can last a few months, right? But it also depends. If you have that one patient that comes in and all they're doing is sucking on it for an hour, right? It'll go through it quicker. So that's why I said it to our patients. I always explain to my patients, and I educate them, like, you only really need 10 as a loading dose, and then every now and then suck on it. I actually try to prevent them from keeping, their mouth whole time because it's actually not necessary. They use it as a crutch because they're nervous, but it's actually not necessary. And once I explain to them, like, let's take it off so that we can start, doing it so it doesn't get in the way, they actually forget about it. They start talking and, they're happy and they're fine. So it can last really a month to multiple months, just depending on the usage of your patients.
Excellent. And if anyone's paying attention, John Malone, I mentioned earlier, he's a clinical trainer. He's actually on and helping to answer some of these as well. And he said approximately 2 hours of normal patient breathing for one e-cylinder, which, to give anybody an idea of how long a cylinder would last. So that's great. Thank you, Dr. Lana. And then a couple more questions we got. I think you might have answered this during the presentation, but just to recap, someone asked, will I be able to drive after nitrous oxide administration?
Absolutely, yes. The nitrous has a very short half-life. So it's actually expired and out of your body, out of your system in, I would say, minutes, like 5 minutes.
Okay. That's great. Another one we got, this might be a John question, but this is also, Dr. Lana, if you could help us out. Where do I get the gases? So that they were asking about where they actually get nitrous or oxygen that they're using for the system.
Yep, absolutely. So in New York City, we have 2 places that we purchase from. One is called IDX Medical. It's actually something that Plymouth Medical set me up with. So if you're not in New York City, I'm sure the team here at Plymouth can help you find, and it's not expensive. It's maybe like $30, $20, right, for a cylinder, and then the company comes and they exchange things out for you as you need, and there's a gauge on the cylinders to tell you just how much is left. But we probably, like I said, ours last like a month, plus, just depending, because we're able to really streamline our protocol to say 5 to 10 minutes of deep breathing, and then we take it away, and then we just go to town, and they're very comfortable. So they don't need to have it on the whole time. Certainly some patients would love to have it the whole time, but it's really not necessary.
Oh, that's great. And I believe when I had spoken with the team at Plymouth, they had mentioned air gas and also Praxair, I think, which if anybody has questions, they can, again, reach out to you, Dr. Lana, or anyone at Plymouth Medical can certainly help them answer that or get the gases that they need. The one other thing, I don't have any other questions that came in through the chat, but I just wanted to draw attention to John's response earlier to Francesca's question, which you answered, Dr. Lana, where she asked, if you have the 0 to 70 Nitronox machine, and John mentioned that unless you're at higher elevations like Denver, Colorado, you'll usually use 50% or less because gases work on partial pressure, which is higher or less at higher altitudes. So I appreciate you mentioning that, John, in the chat. I think that's probably very helpful for certainly our higher altitude practices. But again, if anybody has any additional questions, it looks like we're almost at the end. Tiffany, thank you for commenting. She mentioned she just got her first Nitronox and she's waiting for her gas. She's very excited. So fantastic. Congrats to you, Tiffany. And we're excited you jumped in with Nitronox. Again, any questions for Plymouth or for Dr. Lana, please don't hesitate to reach out. Everybody today will get a copy of the recording of this session. So again, you can watch it at your leisure and go over the information. And we just want to say thank you on behalf of MedShift, on behalf of Plymouth. We thank you, Dr. Lana, and the MedShift, the Plymouth team members who are here with us today. And I wish you all a great rest for joining, and we look forward to seeing you on our next presentation.
Thank you for having me, guys.
Thank you. Take care. Bye-bye.